Hello, everyone, and welcome back to the vlog. Continuing last week's with this week's theme, I want to talk to you more about COVID-19 immunization. And I would like to thank all the people and teams across AHS again who are working so hard to immunize Albertans, as well as those behind the scenes doing all the planning. Because of their work, we're able to vaccinate thousands of Albertans every day if we have the supply. COVID-19 immunization is an important part of our overall approach to protecting patients and staff, because getting immunized is crucial to making our facilities safe for our patients and for each other, and for protecting the health of all Albertans. Now, I know it's natural to have questions and possibly feel some hesitation when a new vaccine comes available, but please rest assured that Health Canada has a thorough approval process that ensures the safety of the many vaccines and medicines that we take routinely, including the COVID-19 vaccines. With me today to talk about the safety of the COVID-19 vaccine and why it's so important to get immunized is Dr. Jia Hu, Medical Officer of Health for the Calgary Zone. So thanks very much for joining me, Jia. So my first question to you is maybe in a 15-second pitch. What would you tell someone on why they should get immunized against COVID-19?
We know how serious COVID is. It's killed millions of people around the world, hospitalized many more. And for those who recover, they seem to have lots of symptoms like fatigue and shortness of breath we don't know about. Fortunately, we're lucky enough to have a vaccine that is extremely effective and extremely safe. And really, it's the best way of protecting yourself from COVID, protecting your loved ones, and going back to what we all used to like doing, like traveling, reopening our economy.
Jia, you're also the chair of 1920, a group of multi-professionals who are working to shift public perception about COVID-19 behaviors and vaccination. So can you tell us a bit more about this group and your work?
So 1920 is a national coalition of people from public health, from government, from marketing sector, from civil society and NGOs, from the corporate community. And the reason we came together really is because to really shift people's behaviors and to really get people to take that vaccine, we need a whole of society approach. COVID-19 has affected everybody. For us to get out of it, every single person has to do things like right now, not go to people's houses, down the road, get a vaccine. And the group really exists to understand why people do what the things they do and improve and encourage people to get vaccinated or follow public health recommendations.
I think one of the things about helping people try to understand the value of immunization is that a lot of the things that have been eradicated, people actually don't remember anymore, right? Things like polio. I mean, even for myself, when I trained in pediatrics, Haemophilus influenza was a really bad disease with meningitis and epiglottitis. And today's residents actually never see that disease anymore because we've got a vaccination for it. So how do you think we can help people understand better the value of immunization?
It's a really good question. And some of the things you mentioned are quite salient to the answer. I think that one of the things that really drives whether or not people get vaccinated or, really follow public health rules is around one, how seriously they take COVID-19. Most Canadians, don't believe it's a hoax, but, are you concerned that it can really affect you? It can really affect your loved ones, or you think you'll just, maybe get it and have that blow right by you. And I think that informing Canadians and Albertans of just how serious and deadly COVID can be is really, really important to driving sort of those adherence to those recommendations. I think another piece around, how do we show the value of vaccination is understanding that the vaccine is so effective and so safe. And, earlier you mentioned that Health Canada, is very, very rigorous in what it does. I mean, they have a very high bar for approving things, and they have the highest bar for approving vaccines because they're the only thing that everybody gets, right? Like not everybody gets, probably vaccines are the only product that everybody gets. And I think, having that trust in Health Canada, trust in the other regulators, and knowing that they will only, allow this to be given if it is absolutely safe and absolutely useful is quite critical. And, lastly, I think just understanding, what matters to people, right? The whole pandemic has led to a complete change in the way we live our lives. And so for some people, it's going to be about protecting their loved ones, especially some of their older loved ones, because that's really where COVID has hit the hardest. For others, it might be about, going back to work because it has caused a lot of unemployment. And for others, it might be, seeing their friends somewhere across the sea. And I think it's really by emphasizing all those things, and ideally coming from somebody that they trust, that will really get people to recognize how important immunizations, and this one in particular, are.
In terms of people who are very hesitant to get the vaccine, what have you learned about what are some of the reasons for that?
Yeah, no, I mean, I think it really comes down to three main factors. Actually, one is, how if somebody isn't really concerned about COVID itself, then they're less keen to get a vaccine. The best example of this maybe in some of the younger people who think that, oh, like I'm just going to get a cold from COVID or something like that. And while that may be true, it can also kill young people. Maybe more than that, I'll say that it would appear that with this long hauler thing, half of people 6 weeks after they're infected have fatigue. A third of people have trouble breathing, and we don't even know what causes that. And I think that, shows that a very high proportion of even very healthy people will have bad effects from COVID. The other is around safety. And, I think the vaccine was approved quite quickly. The way vaccine approvals are done is, there's a few different phases. The first two phases of the studies are about the same. And the third phase was quicker than with other vaccines. And I mean, I think the rationale for that, really is that we needed a vaccine quite quickly given how harmful COVID is. But on the flip side, what makes me more confident about the vaccine is the fact that, nothing has been tested in as many people ever in the history of humanity. And, fundamentally, I really do trust the experts at Health Canada, the US FDA now, and others. And that brings us to the third point, actually. So the third key driver of vaccine hesitancy is lack of trust in governments, lack of trust in regulators, lack of trust in pharmaceutical companies. And that's underpins a huge amount of hesitancy, not just in the US, but also in Canada. And, that's why having the people you trust, like your doctor or your nurse or your pharmacist, recommend that vaccine, or maybe even your pastor or your mom, other people you trust, tell you that the vaccine is good and safe to get is so critical. And, I think that to be successful at getting as many people immunized as possible, we really want as many people telling people to get vaccinated as we can. And that's sort of why 19-0 has so many partners from across society, because you really, one person might not be enough, but, if like your mom and your doctor and your boss, and your priest, they're all telling you to get the vaccine, you're much more likely to get it.
Jia, maybe going to the point around safety, because I know that there have been a lot of questions about safety, including, coming from my own parents. But it would help, I think, to understand some of the steps that are taken to ensure that vaccines are safe, to reassure people who are listening.
So there are many, many sort of layers of protection to ensure that the vaccines are safe. As a starting point, as I mentioned earlier, vaccines literally have to be the safest medical product that we give because of the only one that we give to everybody. And, vaccines historically are extremely, extremely safe. And the vaccines we're giving for COVID share a lot of the same components as, the other vaccines that we normally give. So that's just the sort of the history of vaccination. The way vaccines are studied is, they go through rigorous testing in tens of thousands, probably hundreds of thousands at this point, of volunteers to see if it's safe, if it causes like unusual side effects. And, through that process, they're very closely monitored by experts. We can look to see if people getting the vaccine are having any more side effects than people not getting the vaccine. They usually get a placebo shot, so to speak. And from all the vaccine trials that we've observed, there's not been, any indication that this vaccine causes, any more bad effects than, the placebo or other vaccines we give for other viruses. The other piece that we have then, once those trials are done, is again, we go to the regulators. Health Canada is the one for us. US FDA is the United States, and then the Europeans have regulators as well. And these scientists that work in these regulatory agencies are beyond obsessed about safety because they know that they have to meet, to be approved, a vaccine has to clear a very high bar, higher than, I mean, again, any other medical product. And two, they recognize just how bad it would be if these vaccines weren't safe and they were approved. And so these guys are a lot smarter than me for sure. And, across the world, they view the vaccine as being safe. Once the vaccine has been approved, and in Alberta and other provinces, other countries, it's already been given in people's arms. We monitor side effects extremely closely, right? So if you have any unusual side effects, go to your doctor. We hear about it. We in fact actively seek out people who receive the vaccine to ask questions about any of those side effects. And that sort of post-marketing surveillance of immunization is also a critical step in this whole safety process. At this point, right, like the trials, many trials have been done, many trials are ongoing, but probably tens of millions of people have received vaccine already around the world. And we look to see if there's any signals of a lack of safety, and there really haven't been so far. And so, it's more than just the 80,000 people in the Moderna and the Pfizer trials. At this point, it's the tens of millions of people around the world who've gotten it, and the tens and thousands, hundreds of thousands of Canadians have gotten it. And it seems very safe to date. The only other thing I'll say is that, we always want to balance, let's say, what is the safety of getting a vaccine versus I'll call it the harms of getting COVID. Vaccine seems very, very safe. We know how bad COVID can be, even if people are young and healthy. And so I think for all those reasons, I believe the vaccine is safe.
What are some of the national trends when it comes to vaccination right now?
Yeah, so I mean, very, very good question. Right now, we have about 60% of Canadians saying they would get a vaccine as soon as it was available. Maybe another 20% they would wait. To achieve herd immunity, like if such is even possible, we probably need to hit at least 70 or 80% of Canadians. Fauci keeps on taking it up a notch, once in a while. And so there's still a big gap. And that 60% actually represents the high point of desire to get vaccine. Earlier in the summer, it was around 45%, went down to something like 40% by the end of the summer. And so I don't think that this number is a firm fixed number and the numbers will keep going up. I certainly hope they will. Until we have enough people vaccinated that COVID is not a thing anymore, we're going to have to be vigilant, and we're going to have to keep on educating people in a non-judgmental way, because I think people really do want to do what's best for them and their families, and those things will be updated by the latest science. So we've done a really good job in Alberta of getting people vaccine based on the amount of vaccine we received. But there's still a lot of work to do, both in terms of the convincing people as well as the giving the doses.
Great, thanks very much, Jan, for joining me on today's vlog. I think your comments have really helped to underscore the importance of vaccinating as many people as we can and as quickly as we can. And for those of you who aren't in the current immunization phase or are waiting to get immunized, I ask for your continued patience. We would love to be able to immunize everyone as quickly as possible, but the reality is that it's going to take some time. And we are doing all that we can do to roll out the vaccine as it becomes available. And I appreciate how many of you are wanting to receive your immunization. You would have seen this week that we are facing vaccine shortages, and it's affecting our ability to book additional healthcare workers for their first dose. And we're also having to postpone and reschedule both first and second doses. So anyone whose appointment is being postponed or rescheduled will be contacted directly by HS, by email, and then a text or automated call. An email will also be sent when you're able to rebook appointments, so please do not call HealthLink. If you have any questions about the overall vaccine rollout, contact your supervisor or medical leader or see the staff FAQ. You can also find more information on the COVID-19 page on the HS website, and continue to follow PPE guidance, including continuous masking, continuous eye protection, and infection prevention and control recommendations for COVID-19 to keep our patients safe and each other safe. So thank you again for the incredible work that you all do each and every day. Stay safe, and we will see you again next week.
Together, we do amazing things every day.